Hi, everyone. Thank you for joining us for today's webinar, Microneedling for Acupuncturists. My name is Robin Pierce, and I'm the Senior Brand Manager at L.A.C. OMS. Microneedling, a minimally invasive cosmetic procedure, has garnered significant attention in recent years for its remarkable potential to enhance skin health, promote collagen production, and facilitate the body's innate healing mechanisms. Our webinar presenter, Michelle Gellis, is a Florida licensed acupuncturist and founder of AcuLift. She's currently on faculty at Yosan University and was the former faculty and clinic supervisor at the Maryland University of Integrative Health. She teaches facial acupuncture internationally and has been published in prominent acupuncture publications such as the Journal of Chinese Medicine. Throughout her career, Michelle has been sought out to lecture by numerous prestigious national and international organizations such as the Florida State Oriental Medical Association, the Acupuncture Association of Chartered Physiotherapists, China Books, and American Acupuncture Council. Before we get to the presentation, let's just take a moment to acclimate to the webinar room. To the bottom right of the screen, you'll see two tabs, Questions and Chat. To connect with other attendees or notify us of any difficulties, please use the Chat tab. At the end of the presentation, we'll use the Chat tab to post a promo code specific to this event. If you have any questions for Michelle, please use the Questions tab. Your questions will be answered at the end of the lecture during our Q&A session. Please note that each webinar is recorded, and immediately following the conclusion, you'll receive a link to view the video on demand, a copy of the slides, and a promo code to use on your next order at L.A.C. OMS. So without further ado, I'll pass it over to Michelle.
Hi, thank you so much, Robin, and thank you to L.A.C. for this opportunity to present to everyone. I'm looking in the chat box and seeing a lot of familiar names and faces. So I'm just going to hop right in. The lecture today it's basically 1 hour of what is normally like a 4-hour class. So I'm going to talk very fast, and this is not in any way to be considered to be a full training, but it's really overview of all of the things that you would need to be thinking about and implement if you were to bring microneedling into your practice. So let's see if I can expand this. Let's see, enter full screen. Okay, it's a little bigger. So I was already introduced. So one of the questions I get asked a lot is, I'm already doing cosmetic acupuncture. Why would I want to bring microneedling into my practice? Microneedling is something that is fairly new to our profession. Certainly when I first started teaching cosmetic acupuncture classes almost 20 years ago, microneedling was really just maybe some derma rolling. We did a lot of intradermal needling, but microneedling is like a really nice broad stroke treatment to help to address fine lines, acne scars, loose skin, large pores, lines like crow's feet and lip wrinkles, which can be a little stubborn when we're doing cosmetic acupuncture. Wonderful for dark spots, stretch marks, and it can also help with hair restoration. So what exactly does microneedling do? Microneedling does two things when we're thinking about rejuvenating the skin. It helps to stimulate your body's own collagen production, and it increases the absorption of any serums or skincare products that we put on our skin by as much as 1,000%. There are many benefits to microneedling, and I'm going to run through them real quickly. There's very little downtime with microneedling. Normally, when a person has microneedling, they would go home, and stay out of the sun. And then by the next morning, any redness or irritation is typically gone or almost fully dissipated. The risk is very low. It is very effective. There are hundreds of studies done on microneedling showing its effectiveness for all the things that I mentioned in the previous slide. It helps the body to produce collagen naturally, and again, stretch marks, acne scars, hair loss. It's great for the neck area, and it's relatively comfortable. Some people want numbing cream, some people don't, and the results are long-term. So once someone has been through a series of 4 to 6 treatments, the results can last as long as 5 years. So what exactly do we mean when we say collagen induction? Well, collagen induction therapy can be done either through our needles or through derma rolling or through a microneedle pen. And the way it works is the needles break the epidermis, the outer layer of the skin, and it stimulates the body's immune system to heal the little tiny micro traumas. And there's an inflammatory response that happens, which is why you have to wait a month between treatments, because the body, the skin has to rebuild itself. So here is a cross-section of skin. We have the epidermis, and then the dermal layer, and then the hypodermis, fat, and lower layers. So this is a cross-section of just the epidermis. We have on the very, very surface, we have the stratum corneum. And so the way that the skin works is it rebuilds from the bottom up. So these are the newer cells being built. And then these are the older cells that kind of slough off. So a lot of procedures and things that people do to their skin to rejuvenate their skin, like using retinoids, chemical peels, even laser treatments, they are trying to speed up the sloughing off of this outer layer. But what we're doing is going beyond that. We are going down into this base layer of the epidermis, because this is where the new stem cells are formed that produce new skin. So what happens is the needles go down into the epidermis, and so this would be like a cross section of a microneedle tool, and there is cell signaling that goes on. Your body says, I've been wounded, I need to make some nice, new, healthy skin. So where there was a wrinkle or a scar or a dark spot, it's going to be replaced with nice, healthy skin. And the way that happens is these new collagen fibers are produced. There's fibroblasts, there's venous and arterial capillaries, and they all come together into this area of intrusion, and they create these new skin cells. I had mentioned that microneedling helps to increase the absorption of skincare products. So if you think about your skin as a barrier, when you put product on your skin, a lot of times these expensive serums that we put on our skin, they just sit on the outer layer of the skin, and they can't really get down, whether it's your vitamin C serum or your collagen serum, whatever it is, it sits on the outer layer of the skin, and it can't get down into wherever the damaged or the old cells might be in order to do what it's supposed to do. But by creating these little microchannels, your product can get down in past the epidermis, past that outer layer of the epidermis down to where it needs to be. So here's a biopsy of they took a piece of skin from someone and they stained the collagen purple. And then 6 weeks after microneedling, they took another sample of skin and they dyed the collagen purple again. And you can see how much more collagen there is just from, it was one microneedling treatment. So the needles, again, just go down into the epidermis. It's once a month. And when we're talking about needling the face, it's the depth that we go to is anywhere from 0.25 millimeters to 1.0. But most of the medical grade microneedle pens will go as high as 2.5. You would never do that on the skin because, contrary to what some schools of thought used to be, they used to think you had to go all the way down and get the face all bloody. You might have seen images on social media of people having microneedling and they're all bloody. But what they have found in the past 5 years or so is you don't actually need to go that deep in order to stimulate the collagen. For nano needling, so there's two different types of needle cartridges, the microneedle cartridges, and then there are nano needle cartridges. And the nano needle cartridges are, they're just teeny, tiny little needles. And they really they don't penetrate, they just kind of slough off that outer layer. And you can do that twice a week just to kind of get off that dead skin. And you can use it inside the orbital rim and on the red part of your lips, which you would never do that with microneedles. And this also helps to enhance serum absorption, but it's about 97% increase in serum absorption. And there's a lot less redness. There's no downtime at all with nano needling. So the total time of the treatment, I mentioned in a previous slide that it's a very quick procedure. So the total time for a nano needling procedure is about a half an hour, and that includes your skin prep, the needling, and the aftercare. So it's actually a very quick procedure. And what I do, the way that I incorporate my treatments with acupuncture is I put numbing cream on my patient if they want it. Then I do my pulses and put in some body points. And then once the numbing cream has been on for about 10 or 15 minutes, then I can start my microneedling. So usually 4 to 6 sessions. The results will last up to 5 years, which is very impressive. So if you're looking at the difference between microneedling and cosmetic acupuncture, because people will ask me frequently, they'll say, I am doing cosmetic acupuncture in my practice. How does that compare with microneedling? So if you look at my background is in IT, so I think of everything with Venn diagrams. With microneedling, you're looking at more skin level issues, fine lines, scars. You can work inside the orbital rim, on the red part of the lip. And sometimes there is some downtime with some people. And so the results, as I've mentioned, last about 5 years. With cosmetic acupuncture, not only are you getting to the root of the problem on a body level, but you're also treating very specific points on the face to help to lift the face, working on the muscle level, working on the fascia level, working with blood and chi. And it's much better if someone has like sagging eyelids, sagging neck, jowling, deep nasal labial folds that don't go away even if the person is like laying down. So anything that requires a lot of lifting, you are going to want to do the cosmetic acupuncture. The cosmetic acupuncture is also less expensive. I charge less per treatment. It takes a little longer in the treatment room, but again, you're working at a much deeper level. The similarities, both of them are within our scope of practice. Both of them are going to increase collagen and elastin. So some of the common questions that I get are, why would I go to an acupuncturist for microneedling? They're offering it at the local Medi-Spa, or my esthetician offers it. So in some states, it is legal for estheticians to offer microneedling, but in many states it's not. But people ask me, why should I come to you? And I'll go to the Medi-Spa. And what I tell them is when they come to me for microneedling, they're getting a full body treatment. So they're getting an acupuncture treatment and they're getting the microneedling. So it's very relaxing, and I'm helping to address any underlying concerns. If they have a spleen Qi deficiency, are they blood deficient? So I'm really treating them, because unless you can get underneath a lot of the different signs of aging, the dark circles, the spots, a lot of these things will just keep coming back. If you think about your spleen and how it holds things up, these are all really important things to think about when you're thinking about why someone should come to you and not go see an esthetician or Medi-Spa. Does it hurt? Everyone is different. I just was teaching out in California, and every time I teach a class, we do some microneedling. And there's a portion of people who want the numbing cream, and there's a portion that don't. So it's very subjective, but I always offer numbing cream, and that usually takes care of any concerns that people have. People want to know if they can do microneedling and facial acupuncture at the same time. And in fact, I have a Facebook group. There's like 8,000 people in the group. So if you're interested in being part of a kind of ongoing conversation about facial and cosmetic acupuncture, it's a great group to join. And the way that I do my facial acupuncture and microneedling is I will give a patient 3 cosmetic acupuncture treatments, and then I will do a microneedling treatment. And then, so throughout the month, they can get acupuncture, 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 and microneedling. The other way that you could offer it is if you do a facial acupuncture treatment, they can come back in about 48 hours, depending on how red they are. They can come back for, if you give them a facial acupuncture treatment, I would give about 2 days, and then they can come and get microneedling. I wouldn't do it the other way around. I would wait quite a bit before I started needling someone after they've had microneedling. So you want to wait probably about a week. Or some people, they just want microneedling on their chest or their hands or around their lips. And then you can do your cosmetic acupuncture elsewhere. How many treatments? It depends. It really depends on what it is they want to accomplish, the condition of their skin, their lifestyle. And these are all like very specific things that we go through in the 4-hour training. But a general rule of thumb is for most people, 4 to 6 treatments once a month and no more than once a month. They cannot come more than once a month. More isn't better. The body needs that time to rebuild, just like if you were going to the gym and you were working out your muscles. You wouldn't want to go and work your biceps 3 times a day. It's counterproductive. The body needs to rebuild. How much should I charge? That's another question that depends on a lot of things. In Florida, where I am, I charge anywhere from $325 to $375. It is dependent on how much I'm going to be doing. And that's kind of based on what the going rate is here for microneedling. Different parts of the country, they can charge as much as $600-700 a treatment. But because of the way my treatments are set up, I want to make sure that I cover my costs and my time. And you're going to be using serums. You're going to have needle cartridges that you're going to be using. And I send my patients home with a little take-home kit, which I didn't grab one, but it's a little organza bag with little minis of aftercare and serums. And you're going to have out of pocket with your gloves and your things that you might not normally use in a regular acupuncture treatment. So make certain that you charge enough. So the pen that I use is made by AcuLift, and I have one that's still in its case here. And so it comes in a case like this, and it comes with instructions. But this is what it looks like, and it's nice and lightweight if you're doing a lot of microneedling and you're old like me and your hands get sore. You don't want to be holding some big heavy pen all day long. So it's nice and lightweight, and all the adjustments are easy to see because you want to be able to see the numbers on it and adjust it easily. And you want to know what speed you're working at, depending on what it is you're doing. So when you're looking at pens, you want to make certain that the pen you're using is at least 14,000 RPMs. And for the tips, there's a lot of different tips out there, and each pen usually has one tip that it works with. These are individually sterilized tips that are made for AcuLift, and they have a triple bayonet at the end, so it has a triple locking mechanism both on the edge and on the tip. You put it in the pen and it clicks on. You don't have to worry about it vibrating off the pen. It is locked in there, and where it locks into the pen, there's 3 places. You probably can't see it with the lighting, but there's 3 places inside the pen where these 3 little knobs go in when you lock it. So having a good locking mechanism. I'm not a big fan of the ones that screw on because they can vibrate off. Having the versatility of either battery powered, so you want to have a couple of chargeable batteries that come with it, plus a cord in case you forget to charge your batteries. And then a lot of people ask me, well, can't I just, buy something online? You really want to find something that has a warranty and support. If something happens to the pen, it stops working, who are you going to reach out to? Are they going to support you? And marketing material, any pen that you buy from wherever you buy your pen from should have a ready-made system that you can implement with brochures and a web page and blog posts and before and after pictures, all of your marketing material so that you don't have to now start implementing this on your own, spending all your time and your effort doing that. That should all be done for you. And also, does whoever it is you're getting the pen from, do they have a website with a referral service? So if someone buys a pen, if you buy a pen from a company and then someone calls them and says, well, I'm really interested in getting microneedled, have you trained anyone? They have a list or a referral service where they can send people to you. And these are all really important things to think about. So I already went through all of this. And so these are examples of the different cartridges. You can see them better here. This is the AcuLift cartridge. And these are what some other ones look like. This is a screw type, and then this is the double bayonet. The AcuLift cartridges come in nano needle or 16 needle. So these are the little needles. And the nice thing about getting an AcuLift pen is I personally, as an acupuncturist, approve the needles. You definitely want to have the right number of needles, not too many, not too few. And you want to make sure that the needles themselves are made well. And these cartridges are single use. You use it one time, even if you're using it on yourself, one time, and then it goes into the sharps. So this would be the microneedle cartridge, has 16 needles, and the microneedle cartridges can be used anywhere on the face, the neck, the body. You wouldn't want to use it on the red part of your lips, inside the orbital rim, on any mucous membranes or any open wounds. And the sweet spot, the reason why I chose 16 needles is if there's too many needles, the needles will not penetrate deep enough. And if there's too few needles, then they might penetrate too deeply. If you think about walking on a bed of nails, right? So that is something important to think about. The microneedling versus the nano needling. Nano needles, and this is actually a nano needle tip that I have here. The nano needles, let's see, I can take this off and push it. They don't even really look like needles. They're just barely visible to the eye. And as I mentioned, they're much better for more frequent use, just to kind of exfoliate. And here's a close-up. This is what they look like. They're 110 micrometers long, which is not very long at all. And they're stainless steel. There's a tiny little layer of silicone so that they can glide on across the skin. So contraindications, that's a big question. Is microneedling for everyone? Well, if your patient is on blood thinners, you need to know about that. It may not be completely contraindicated, but it's something you need to know about so that you can adjust your needling depth accordingly. Certainly, if someone's undergoing chemotherapy or radiation, you would not want to be doing microneedling on them. People that are on oral steroids, or even if they're using topical steroids on a long-term basis, they can have a much, it can take them a lot longer for their skin to heal. So you need to know about this, and it may be contraindicated. Any skin condition that you're unsure about, if they have pustule acne, if they have herpes, if you're not sure, look it up, because we're not dermatologists, most of us, and there are so many different things that the skin can become afflicted with that it's really important to know whether or not microneedling is going to be safe for your patient. Certainly if they have severe keloids, the microneedling is just going to cause the keloid scar to proliferate, so you don't want to be doing that. And if someone is pregnant, I would not be doing microneedling on them. So I had mentioned that there's a lot of stuff that you have to purchase. And I know LASA sells some of these things, and some of these things I get on Amazon, but things like tongue depressors, rubbing alcohol. I have 2 spray bottles, one with rubbing alcohol and one with water, which I'll explain in a minute. Makeup remover wipes, numbing cream. I like headbands, the disposable type, to get your patient's hair out of the way, and then latex-free gloves. So when you're setting realistic expectations for your patient, they're going to want to know, again, how many treatments, how long is it going to take? There are a variety of things that you need to think about, and you need to discuss with your patient. Things like a person's age, what is their skin type, what is their lifestyle, their diet, their exercise, sleep, water consumption, their skincare routine, their genetics. What is their TCM diagnosis? Are they blood deficient, G deficient, immune deficient? All of these things are going to determine how many treatments that your patient will need. Again, the results from like the first treatment, the results, and every subsequent treatment, but results can take up to 2 weeks to even notice anything. So it just depends on how deep you go and how quickly their skin rejuvenates itself. And if they do want to come in between treatments, once it's been about a week, they can have a nanoneedling session. But I usually do the microneedling and nanoneedling together. So I microneedle the face and I nanoneedle places where I can't microneedle. And you have to let your patients know that any prescription products that they're using will absorb more quickly. So when you're getting ready to do your microneedling, you'll need your tongue depressor, your numbing cream, your gloves, your makeup remover wipe, alcohol. You'll need your pen and your tips. And I keep some distilled water. And then I have I actually use disposable soy sauce dishes and an esthetician's fan brush. And these are very inexpensive. I think 100 of these soy sauce dishes is just like a few dollars. And that way I can put my serum in there and I can kind of mix it up with the fan brush. And I use the fan brush to put the serum on instead of my fingers. And that way my pen is, I'm not getting, everything isn't getting all full of serum. And I don't have to touch their face with both of my hands. And sometimes I don't have to touch their face at all while I'm working. And if you stay to the end, I do have a short demo that I'm going to show. So people ask me a lot about needle speed. So this this pen it goes from 1 to 6, and I always recommend when you're first starting out, start on a lower speed, like 4 or 5, until you get used to it. Because what I see a lot in my students that have never microneedled before, they'll put it on a higher speed and they'll be working, and then they'll go, uh-oh, I did too many passes, or I pressed too hard, or I went too slow, and the person will be very red. So if the needles are moving a little more slowly, it isn't going to be, it'll give you a nice learning curve is what I'm trying to say. And when you're working on the body, you can work a little faster because you're working on larger areas. So for the stretch marks, acne scars on the back or the chest, and if you're working on a really deep wrinkle, you want to spread it. And I'm going to kind of go over the different movements in a moment. So this is just a rough guideline for different areas of the face, and different areas of the face, you might adjust the pen a little deeper, a little less deep, depending. You really want to think about, does this person have older, thinner skin? Do they have, is their complexion more fair? You're going to want to dial it down. Do they have younger, darker, thicker skin? You might be able to dial it up a little bit. But what I tell my students is you can always go back and do another pass, or you can go back and do it more deeply. What you can't do is, once you've gone too deep, you can't undo what you've done. So you want to do a pass, and then you move to the next area and you wait and see. The clinical endpoint you're looking for is pink. You're not looking for the person to be bleeding. So once you do an area, you go to the next area and you wait for that first area, you give it a minute, and you'll see how pink is going to get. There are instructions before you needle someone. I usually ask them if they're taking anti-inflammatory medication, and they can, if they can avoid taking that. Avoid drinking alcohol for a couple of days beforehand. Fish oil tablets, anything that thins the blood or brings a lot of heat into the skin. If they're using Retin-A, prescription Retin-A, I tell them to not do that for at least 3 to 5 days, preferably a week. And this helps to minimize the bleeding and the redness and how much downtime they're going to have afterwards. So I'm going to quickly go through my protocol. So first thing, of course, you wash your hands. You're going to glove up. Make sure your patient has a clean face. Either use makeup remover wipes to get the makeup off, and they should come with a clean face, no makeup. And then you're going to put numbing cream on, leave it on for, depends on the numbing cream, usually 10 to 15 minutes is good. And then while that's working, I put in body points and any maybe auricular points that you might do to calm your patient down. Then I take a makeup remover wipe and I spray it with alcohol, and I put it on, that's how I take the numbing cream off. And then I put some serum. All of the serums that I carry are, they're all organic and vegan, and they're all made in very small batches, and they have ingredients that your patients will recognize. So I take a little soy sauce dish and I put a couple of squirts of the base serum, which is the Superb, and then I'm going to add in some Revive or some Nourish, and these are for different types of skin conditions. We don't have time to go into that now, but you would add a little of that in. And then my secret ingredient is a little bit of water. And the reason for this is the Superb serum is hyaluronic acid, and it also has vitamin C and collagen in it. But the hyaluronic acid will attract the water, because what can happen is you put the serum on and it absorbs so well that it can absorb into the skin before you even get done microneedling. So just a little bit of water helps to take care of that. So you mix it up and you do a small section, and you adjust the settings on your pen, and you want to keep your pen upright as much as possible. And I like these sleeves. In the demo, you'll see me put one on. It's just a plastic sleeve, and you put that on, and you're going to use minimal pressure. So these needles are very sharp. You don't have to press down very hard. If they've got a deep wrinkle, you stretch the skin, and then I start and I build the perimeter of the forehead. I work in a small section. Then the other section, I go back and forth, up and down, work between the eyebrows. And then I work around the eyes, the cheeks. I make sure to get in front of the ear. And if they have large pores on their nose or a bunny line, I will microneedle their nose, around the lips, chin. So I start from the top and I work my way down. And if you're going to do their neck, you do underneath the chin and then across the neck and the chest. Again, the clinical endpoint is pink, not bleeding. And then when you're done, the Calm Aftercare spray comes in a spray bottle. So you don't even have to be touching the skin when it's all sensitive. And this is arnica and aloe and CBD and a bunch of other wonderful ingredients to help to really calm the skin down. And they get a little bottle of that in their take-home kit. And then you would remove any of the acupuncture needles that you've done. You give the patient their take-home kit, which has aftercare instructions in them. And that way, if the patient wasn't listening when you were telling them the instructions, they have it. Just quickly, there's a few different movements that you can do with the pen. So going up and down, left to right, just like for those of you who've been with me a long time, you know, the derma rollers, up and down, left to right, it's like aerating your lawn. If you really want to cover all your bases, like if you're working on a big area like a forehead, you can do some circles. And if someone has a dark spot, you take the tip of the pen and you just press it up and down. And this can really help to break through the walls of any scars, stretch marks, or if you're doing hair. And I have a separate training that I do just for microneedling the hair. So you go just like this, or you can push the hair back and you just go in one direction. I use this magic eraser technique for both gua sha and also when I'm microneedling, and you really should only do this on a bony area, but kind of left to right. And you can also do it right over the cheekbone. You spread those crow's feet and get in there, or around the lips. You just have to be careful of the teeth. And then if you're doing the eyebrows. So nanoneedling, as I've mentioned, red part of the lips, gentle pressure, and just a really simple horizontal movement. I've already showed you how to load the pen. Possible side effects, some pinpoint bleeding, redness, itching, maybe some burning, skin irritation, and typo, pigmentation changes are possible. So if you have a patient and they have any sort of hypopigmentation or hyperpigmentation, you would want to do a test area like behind their ear and the back of their neck to make sure ahead of time this isn't going to be an issue. So as far as aftercare, there's a whole series of aftercare instructions. Your patient, I tell them just go home, especially I live in Florida. The sun here is very strong. They're going to be red probably for 8 to 12 hours. No exercise because sweat can irritate the skin. No sun, no makeup, don't wash your face. If they absolutely have to, they can put a little water on their face. Peeling is normal. Use the calm spray and the other products that come in the take-home kit. And so this is kind of what we're looking at. So here's before. This was the old AcuLift pen, the OG. This is during and this is after. Here's some pictures of acne scars and wrinkles. And then I had done some microneedling on my eyebrows, and I never really had eyebrows. So I thought, what the heck, I'll give it a try. And I was actually quite surprised. What I used to do is I would use eyebrow pencil, and then I had eyebrow mascara to make myself look like I had eyebrows. But after microneedling for a few weeks, I was doing it a couple of times a week, I went to put my eyebrow pencil on, and I thought, oh, I must have some on from last time. And I went about my day. And then the next day I went and I realized that it was actual hair. And for the first time in my life, as you can see all these hairs here, I had to go and get my eyebrows waxed. And it's real, actual hair. They're not microbladed on. So it's pretty impressive. We talked about pricing. You could do pricing for different areas, just the brows, just the mouth, neck and chest, hands only. Real quickly, when you're looking at products, anything that you use should be something that all of your patients will be happy with. So organic, vegan, easily absorbed. You want products that do things, and you don't want to be a chemist. So keeping it simple. All of this, I only carry 3 serums. One is just your base, and the other 2, one is for more older skin, and the other is for like acne skin, stressed skin, younger skin. But you want a product that will brighten and nourish, that doesn't clog their pores, something that is anti-inflammatory, because there's a lot of inflammation with microneedling. You want to make sure that you have an aftercare product that will protect and treat, and that whatever it is you're using has enough slip so that that microneedle pen can move along the face. So here's the AcuLift system. These are the little take-home products, aftercare, and the 3 serums. And this is the entire system if you buy the micropen system. And now I have a quick demo. They said they were gonna bring it up.
And just a drop and some 4 squirts of the Superb serum. And for her, I put a couple of pumps of the Revive. And then when it comes to mixing the products up, and you always want to wear gloves when you're doing microneedling, although you should not have any bleeding, there can be some pinpoint bleeding. So you definitely want to make sure that you have gloves, and you can either use one of these little makeup brushes, and I just buy a bunch of them and they're disposable. I don't recommend trying to wash them and reuse them because you're dealing with potentially bloodborne pathogens. So I mix that up a little bit. And then what I do is I take the makeup remover wipes, and I like the micellar wipes. And it's spelt just like it sounds, micellar. They have like little ridges on them, and so she's got the numbing cream on, and now I am going to just take this and I am going to spray it with some alcohol spray, and I'm going to and spray it away from their face. And I'm just gonna wipe this off carefully so you don't get it in their eye. And I put the numbing cream on pretty thick, and it takes about 15 minutes for it to really take effect. You can, if you want, some people will take one of those sheet masks and put it on top to really get it to get in. But you don't want to use like a cloth mask. You want to use something that's not porous, and you can do that. Okay, so that's that. I'm just gonna put my garbage here. Then for the pen, as I mentioned, I like using the sleeve. The purpose of the sleeve is it keeps all the serum from getting all over the pen. So it keeps the pen clean, and it also gives you a tiny little bit of extra protection between the cartridge and the pen. And there's a arrow on the pen, and when I'm working with someone new, I will always start at a 0.5, and if they're older, I might even start at a 0.25, because you can always go back, right, and dial it up, but once you've done too much, you can't make it go away. So always err on the side of caution. So this is a new cartridge. Again, after you use the cartridge, it goes right in the sharps container. And when you're brand new to microneedling, it's a good idea to start at a lower speed, and that way there's more wiggle room for error. And the lower speed, the needles are moving slower in and out, so it's making fewer holes in the skin. And microneedling is all about opening the skin up and stimulating collagen. So for right now, so as you can see, the numbers, every time you push the button, it goes higher and higher. And I like this because it actually shows you the number. You're not having to guess what speed you're at. So I'm going to start on 5. Whoops, pressed it too many times. And I'm just going to, I always start at the forehead because that tends to be the most sensitive. Kind of get that out of the way. And you work a little section at a time. You don't put the serum all over the face. You just work a little section at a time. And what you want to do is you want to start at the perimeter. You always want to build the perimeter because you're building collagen around the perimeter. And I work left to right, just like this. So about 1 inch per second, not too slow. And you don't have to press very hard. I'm just pressing hard enough to make contact with her skin, but not so hard that, immediately she's gonna start getting red. It doesn't require a lot of pressure. So once I've gone left to right on the forehead, I'll go up and down, kind of like aerating your lawn. And you just want to make sure you have lots of good slip. Then once you've done that, you can make some little circles just to make sure you got everything. And she's getting just a little pink, which is good. You can do the eyebrows like that. Those of you who've seen my video, you know that I essentially had no eyebrows before I started microneedling, and these are not drawn on. I have nothing on my eyebrows right now. These are just from microneedling. So even if she's just a little pink, and I think maybe I could do a little more, I wait. I go to the next area. Turn this off, I love these little stands, again, Amazon. Put the pen on it, and this prevents the pen from rolling onto the floor. And then the next area is the cheeks. So I'm going to turn your head a little bit, and that way the folks on the other side of the room can see as well. Since your face is up, everyone can see. And get a little bit on her nose. So you just make sure you have plenty of serum. Now you cannot microneedle inside the orbital rim. You can nanoneedle inside the orbital rim. I don't have brushes for everyone, so you can use your finger, but just make sure you're using the same finger. You're not putting your finger in there and then touching other things and then touching their skin. So, turning it on again. And as you can see, she's starting to pink up, because what'll happen is it takes the skin a while for that heat to come up, and if it doesn't, you can always go back to it. So, left to right. How does this feel, by the way? She seems fine. I don't see her freaking out or wincing. So I'm doing the perimeter again, up and down. This table's a little high for me. But. So, are these freckles or are these
No.
sunspots?
A sunspot.
Okay, so if they're sunspots, you just kind of dab at them like this, and it'll really break them up. She doesn't have a lot of wrinkles per se, but this really helps with the skin discoloration. I know, it doesn't feel great.
It's a little sharp on the bone on the forehead, but it's fine everywhere else.
Yeah, that's why I said.
So I thought I had edited this. Just wanted to give you guys a quick little overview. It's supposed to be like 6 minutes. We've already gone 9 minutes into the 20-minute demo. I don't know if my loss of people are there, if they can hear me. Can we come back to me? I can't hear you.
Hey, Michelle.
Hey.
If you
Sorry.
Did you want to keep going with the video, or did you want
No. It goes on for forever, and I just wanted to kind of give them an overview. You guys must have the link for the full-length video somehow instead of just the little one that was whatever. It doesn't matter. Here we are.
Right.
So they got a little extra today. I just want to make sure we have time for Q&A.
Yes, perfect. Quick thank you before we get into that. And I just want to say we have a few minutes, so we'll go through a few questions. I'll read them off to you, and then if you want to answer. And then anybody who we don't get to, as far as your question goes, send it to marketing@lasaoms.com, and we will do our best to get you answers. So we'll start out and get through as many as we can in a few minutes. Is microneedling contraindicated in rosacea?
It depends. There's a lot of different types of rosacea, and it can be beneficial for certain types. So what I tell my patients when they come to me, as I mentioned, with any skin condition, if I don't know what it is exactly, I will tell them, speak to your dermatologist. The good news is dermatologists do microneedling, so they know all about it. And that would be the person to say, you're okay, because some forms of rosacea are so inflammatory that it could just make it worse.
Okay. On myself and on patients, it seems like microneedling is really good for fine lines and making the skin look refreshed, but doesn't seem to address sagging like on the neck.
Right. And if you recall, one of the first things I said was microneedling is not going to help with saggy skin. It very skin level. So if you think about the layers of the face, so the skin on the face, It's the only place on our body where the skin is connected directly to the muscles, which is why you can move the skin on your face without moving any joints or bones. And when you're seeing those deep lines, what you're seeing is the underlying structure that the skin is attached to, whether it's fat or loss of fat, the muscles, fascial adhesions, bone loss. All of this is going to determine those deeper lines, but the microneedling is only going to address the kind of the superficial fine lines, and for everything else, you need the acupuncture.
Okay, someone is asking what serum you recommend. Would you mind just saying that again?
Okay, so the serum that I recommend is from AcuLift. It's called Superb Serum. And as you can see, it's hyaluronic acid, collagen, and vitamin C, and that's it. And then I add in either Nourish or Revive, either one of these, depending on whether your skin is older or younger and what kind of skin conditions you have. One of them is more of a peptide serum, and the other one is has a lot more vitamins and things of that nature. Again, when you purchase a pen, it comes with a 4-hour training, and there's a whole hour just on what to use. But there's an explanation of what's in the serums and how to use them, and they all have hyaluronic acid in them. So
perfect. Thanks for saying that again. Do you need to stay out of the water or the sun?
Yes. So you cannot go out in the sun right after microneedling. I tell people for 12 hours. I just say don't make any plans for that night because, again, I live in the Sunshine State. So it's sunny here all the time. So no going out in the sun. And as far as water, I definitely would not be going in salt water, chlorinated water, any kind of water for 24 hours, and maybe more if they had any pinpoint bleeding.
Okay. What is the recommended price per treatment currently?
Okay. So I went through all this, and if you can maybe grab questions that I didn't talk about.
Sure can.
I don't know if you were listening.
I was. I didn't know if you. I think you said it was about 350, 375. Is that?
Yeah.
Okay.
That's the short answer. The long answer is, it depends.
Perfect.
Where
okay.
you're practicing. So.
And everyone will get the slides after, so they can go back and see that also. When you do the nano needling, do you have to hold on facials? My current esthetician states 6-month wait for any facials post micro needling.
Oh, microneedling. No, I microneedle myself once a month, and I get facials once a month. So I'm 63 years old, and my skin's getting more and more fragile. So no, I mean, I would a month. I would wait a month till the skin is healed. But I don't know what kind of facial they're getting.
Yeah.
Maybe it's like
Okay. Do you use both micro and nano needling on the same person?
Yes. Yeah.
Okay.
Because you can't microneedle on the red part of the lips or inside the orbital limb. So I do all my microneedling, and then I just do the nano needling on the red part of the lips and around the eyes. So I do use 2 cartridges for every treatment.
This one's pretty specific. Have you done microneedling for neuropathy after a dental procedure?
No. No. To treat the neuropathy?
Yeah, I'm not sure about that one.
They can, you know, I'm not sure I understand the question. You wouldn't treat neuropathy with microneedling, because microneedling is just skin level. I guess if you wanted to re-educate the skin, if it was a muscular thing, but not a neurological thing, no.
Okay. How much time is a session normally?
So 30 minutes from beginning to end, usually.
Okay. What numbing cream do you use?
Ah, so I use Ubernum. I was using another numbing cream that it's a benzocaine, lidocaine, and tetracaine, but it was like 4 times as expensive, and I didn't really think it did that much more. So you can get Ubernum on Amazon. So the sleeves, the little, I didn't grab one, but the little thing that you can put the pen in, the little plastic pen holder for your table, all that stuff, you can get all that on Amazon.
Great. Can you compare microneedling to the roller?
Yeah, I get asked that question a lot. I still love my derma roller. You know, derma rolling, if you do derma rolling gently, you can, it's derma rolling, if you do it gently, it's kind of like nano needling-ish. You're not going to get the kind of that deep level treatment with a derma roller, but I mean, it's great. I still, when I'm doing cosmetic acupuncture on a patient, if they're not getting microneedling, I always encourage them to get a derma roller to use in between treatments. So
Great suggestion. Why do you need at least 14,000 RPMs?
So the speed at which those needles are going up and down is determined. The number of holes, right, that you're going to make is determined by the speed of the pen. And if you're not going quickly enough, it would be like, how can I come up with an analogy? Like if you were aerating your lawn and you were going really slowly, as opposed to getting those needles in and out while you're moving the pen, right? If the needles aren't moving fast enough, you're going to be, yeah. So yes. And these are guidelines based on a medical grade pen, as opposed to a lot of the commercially available ones that, you know, from what I understand, you can get a microneedle pen just about anywhere. And I wouldn't, these things are not like razors. I mean, this is a piece of medical equipment, and these are approved for use in the treatment room by the American Acupuncture Council. And by me.
Yes, need to say that. We have time for just a few more. Smokers have a lot of bleeding with acupuncture facials. Do you treat smokers with acupuncture facial or go with microneedling?
Wait, could you read the first part of that again?
Sure. Smokers have a lot of bleeding with acupuncture facials. Do you treat smokers? Yeah,
I do. And the reason for it is just heat. It's heat in the blood, right? The blood is literally boiling out. I do, and I'm very mindful. If you don't notice, I repeat myself a lot. I have the same stories that I tell over and over. But I had a patient when I had my practice before I moved here. I had a patient who came to see me once a week for almost 20 years for cosmetic acupuncture, and she always came on a Saturday morning, and on Friday night she was always going out with her friends, you know, having a little raise the roof time, and she would bleed, and I would say to her, you know, you'd bleed a lot less if you didn't drink so much the night before. And on the few occasions that she came to see me, like during the week or right after work, it wasn't as big of an issue. So yes, you can have a lot more bleeding with people who smoke and drink, and but I still treat them.
Okay.
Because they're going to have, the smokers are going to have the most smoke, the lines, and smoking destroys your skin.
Okay, we'll do one more.
Okay.
How does AcuPen compare to Skin Pen?
The AcuLift micro pen and the skin pen. I don't know a lot about the skin pen, but I do know that it is only sold to medical doctors. And I think it has something to do with their insurance. I've seen one. I actually held one time at the place where I go to get facials. She had one. It was heavy. It was very heavy. But it wasn't, as far as I could tell, it doesn't do anything like more miraculous than the AcuLift pen.
Okay, great. Well, thank you so much, Michelle, and thank you all for joining us today. Again, if we happen to miss any questions, feel free to reach out to us at marketing@lasaoms.com. Be on the lookout for an email with a promo code, which is MG424 for reference, and a link to view the slides. Thank you all again for joining us, and we look forward to seeing you at our next webinar.
Thank you.
Thanks, Michelle.